Ever had that unbearable itch in your groin area that just won't go away? The irritation, the constant discomfort, especially in the most sensitive parts of your body, can drive you mad. It's frustrating, awkward, and let's face it, embarrassing to even talk about. But here's the reality, you're not alone. Millions of people face this exact issue every single day. And while it may seem like just an irritation that will eventually pass, if it's scrotal eczema, it's not something you can just ignore. It needs attention. What exactly is scrotal eczema? Scrotal eczema, also known as scrotal dermatitis, isn't contagious, but it's definitely uncomfortable. Think of eczema as the skin's way of crying out for help. Your skin becomes dry, itchy, inflamed, and cracked. It can even affect areas beyond your scrotum, like your penis, groin, and even the skin around the anus and thighs. What's happening here? Your skin's natural barrier is compromised. And once that barrier breaks down, even the smallest triggers can cause a big reaction. Let's paint a picture. Imagine your skin is a sturdy fence. Over time, if that fence isn't maintained, whether it's due to a genetic factor or environmental triggers, it starts to break down. Gaps form. And just like how animals can slip through the gaps in a fence, allergens and irritants sneak into your skin, causing inflammation, redness, and itching. Why does it happen? Scrotal eczema can be caused by multiple factors. It's not just about hygiene or bad luck, it's deeper than that. There's a mix of genetic and environmental factors at play here. Some of the most common triggers include atopic dermatitis, a chronic condition where your immune system overreacts to harmless substances. Contact dermatitis, maybe it's the soap you're using, the detergent in your underwear, or even the latex in your condoms. The things that touch your skin matter. Sweating and friction, tight clothes, constant rubbing, and sweat build-up are a perfect storm for eczema flares. What's more frustrating? The condition comes and goes. One day you think you're in the clear, and the next, you're itching again. It's like a roller coaster of discomfort, and the ups and downs can be hard to predict. Symptoms to look out for now: scrotal eczema doesn't look the same for everyone. It can appear as dark brown, purple, or ashen gray on darker skin tones, and red or inflamed on lighter skin. But the most common symptoms include intense itching. Sometimes, it feels like no amount of scratching can relieve it. Redness or dark patches, the skin can look irritated or discolored. Lichenification, ever notice the skin getting thicker, almost leathery? That's from too much scratching. Source: scratching can lead to open wounds, increasing the risk of infection. What's the catch? Scratching only makes it worse. It starts an itch-scratch cycle where you scratch to relieve the itch, but it ends up making the skin more irritated, causing you to scratch even more. It's a vicious loop. Scrotal eczema versus jock itch. This is where things get tricky, because scrotal eczema shares similarities with other groin conditions. Take jock itch, for example. They both make you itchy and uncomfortable, but jock itch is a fungal infection. It appears as a red, ring-shaped rash and requires antifungal treatment. Meanwhile, scrotal eczema is more of a chronic skin condition, and it's not caused by fungi at all. Here's a simple analogy: if scrotal eczema is like dry, cracked soil in a drought, jock itch is more like mold growing in a damp area. Both thrive in different conditions, and both need their own treatments. The emotional toll. It's not just your skin that suffers. Chronic itching and discomfort can wear you down mentally. Imagine feeling self-conscious in every social setting because the irritation never goes away. This is why scrotal eczema can sometimes lead to depression or anxiety. It's not just a skin issue, it can affect your mental health, too. Now, this isn't meant to scare you, it's meant to show that there's more to this condition than just physical symptoms. And the good news is, there are ways to manage it. What you can do about it: let's be real, there's no cure for eczema. But there are ways to manage it and reduce the flare-ups. The first step is identifying your triggers and making lifestyle changes to avoid them. Wear loose, breathable clothing, avoid tight underwear or pants that trap moisture and cause friction. Moisturize regularly, keep the skin hydrated. Look for gentle, fragrance-free moisturizers to avoid irritation. Avoid irritating products, harsh soaps, deodorants, and even certain condoms can set off a flare. Try switching to hypoallergenic, unscented products. Maintain good hygiene, clean the area daily and gently pat it dry to avoid moisture buildup. Manage stress. Stress doesn't cause eczema, but it can make it worse. Finding ways to relax, whether it's through mindfulness or exercise, can help reduce flare-ups. Sometimes, though, lifestyle changes aren't enough, and you'll need medical intervention. Medical treatments. Doctors may prescribe treatments like topical steroids, or calcineurin inhibitors. These creams help reduce inflammation, but they come with their own set of precautions, especially for sensitive skin areas. Antihistamines. If the itch keeps you up at night, these can help calm things down. Biologics. For severe cases, medications like dupilumab, Dupixent, can help by calming the immune system's overreaction. Antibiotics or antifungals. If scratching leads to an infection, doctors might prescribe these to clear it up. While these treatments can help, prevention is key. How to prevent flare-ups. The best way to manage scrotal eczema is to prevent flare-ups in the first place. Here's how. Avoid triggers. Identify what causes your eczema to flare, whether it's sweating, certain fabrics, or stress, and work to minimize exposure. Stay consistent with skincare. Eczema thrives when your skin is dry and irritated. Keeping your skin moisturized and protected can go a long way in preventing flares. Consult your doctor regularly. Eczema can be tricky, and it's important to get professional advice to make sure you're on the right track. Conclusion: it's manageable, not hopeless. Yes, scrotal eczema can be uncomfortable, embarrassing, and downright irritating. But here's the truth: it's manageable. By understanding what triggers your flares, making some lifestyle adjustments, and working with a healthcare professional, you can control the symptoms and improve your quality of life. Don't let the itch control you. Take charge of your skin health today. Final thoughts: millions of people face eczema every day. If you're experiencing symptoms, you're not alone, and there's no shame in seeking help. Whether you manage it with home remedies or need a little extra help from medical treatments, what matters most is that you don't ignore it. Your skin's health deserves just as much attention as any other part of your body. Keep it clean, moisturized, and stress-free. Your future self will thank you. Thank you for watching, and if this video helped you, don't forget to subscribe for more easy-to-understand health content that brings you solutions for real-life issues.
Yeah.